Hello and welcome to this lecture on group model building for the Global One Health course at the Wageningen University. My name is Henk Broekhuizen. I'm a postdoc of climate change and health, and I work at the Department of Health and Society at the Wageningen University. I will tell you something about group model building using a case from my previous job at the Radboud University Medical Center in Nijmegen. And the question that I would like to answer is, how can an intervention be sustained in a complex system? And the tool that we will use is group model building. Why is it that it is so hard to implement or sustain interventions? Well, I would argue that it is because there are often many actors involved, and all of these actors have their own incomplete view of the system and of the intervention. But in the end, you need all of them to make implementation or sustaining work. But why is it so hard to implement, and why is it so hard to combine the knowledge of all these people to get working solutions? I think it is because we are lacking understanding of one another. My knowledge, experiences, views, beliefs, language, and jargon is probably different than yours. And when we are talking, we don't understand one another. And I would argue that group model building can help build diagrams or models through discussion that can bridge this gap. Why? Well, it requires people to be explicit about what they mean. There is room for discussion and questions, and the results are a concrete product of this shared building of understanding. But how are you going to do this? I'm going to show some examples from our previous work in the Search Africa project. And let's just dive straight in. Group model building is a workshop method where you have, first of all, a varied group of participants. So participants from all over the system. In our case, it was clinicians, administrators, people from government, senior people, junior people. And they all come together in a room to talk about a problem. Secondly, you need a facilitation team, people who can organize the whole session, who can moderate the discussions, and who can do all kinds of practical things like handling the laptop. And why do you need the laptop? Well, the third thing you need for group model building is a screen with a diagram that can be changed in real time. And this real-time model that is on the screen, that is actually the boundary object. That is the thing that all people in the room are looking at together, are discussing together, and together they are building an understanding of the problem. And we conducted these kinds of workshops in 3 countries, Malawi, Tanzania, and Zambia. And let's see how it works in practice. The start of a group model building session is always very simple. There's one factor on the screen, one thing that really matters. In this case, it is the volume of surgery at a district hospital, meaning how many patients are treated. And a facilitator may ask the group, what happens when we do more surgery? And one of the people may say, well, benefits for patients will go up. And if the whole group agrees, what you can do is add a new word and an arrow with a plus. And a plus with an arrow means that these two factors change in the same direction. So if you do more surgery, there will be more benefits to patients. But also the other way around. If you do less surgery, there will be less benefits to patients. And that sounds about right, says the group. There is also a different kind of relationship that can be in the model. The group may say, if we do more surgery, we need to refer less patients to other hospitals because we can do them ourselves. Well, that's easy to add. Here, you can make an arrow with a minus sign. This means that the two factors change in the opposite direction. So, if you do more surgery, it means your referrals go down. But also, if you do less surgery, you need to refer more patients. Okay, and in this way, the group will build a diagram, taking it one step at a time. Think about this one. If we do more surgery, would there be more or less opportunities to practice? Think about it, and I think you will agree it should be a plus. More surgery means there's more chance to practice. The next one. If there's more opportunities to practice, will there be more capacity and skills or less? Well, obviously more, that makes sense. And again, the same, with more skills leading to more surgery. And what you see here is that there's a circle in the diagram. A volume of surgery leads to practice opportunities, then to skills, and then back to volume of surgery. This is a reinforcing feedback loop. And depending on the context, this can either be good, a virtuous cycle, or bad, a vicious cycle. Okay, another one. Supplies. If you do more surgery, more supplies will be used. And then if you use more supplies, what will happen? Well, supplies in stock will go down and the other way around. What you see here, if we complete the diagram, is that another type of loop is created. This is called a balancing or limiting feedback loop. This means that the system tends to go back to the same place it was before. Let's look at it. It means that if volume of surgery goes up, supply use goes up, which depletes the stock, which in the end again decreases the number of patients we can help. This is of course a very simple model, but the key takeaway from this is that the behavior of the system as a whole depends on the complex interaction of all these feedback loops. And the group in-group model building will build a diagram like this, but of course just much bigger for their particular problem. Let's look at an example. Here is our work from Zambia. This is the combined diagram from 4 workshops, and the contents don't really matter, but what you should remember is, well, this is a very complex diagram, but the diagram only reveals the complexity. It doesn't create it. It was already there, but now you know what is going on. And the colors that you see in this diagram are the actions that different actors can take to sustain surgical mentoring. And what you see is that in order to sustain surgical mentoring, different groups of actors need to act on their own turf, as it were, to sustain surgical mentoring. And the classical notion of, well, to do anything, Ministry of Health should organize it for us, that's not the case. There are much more stakeholders that have an influence here. And this was just a small demonstration of group model building, and there are a couple of things to keep in mind. First of all, it's quite easy to organize a group model building session with only little technical knowledge, but it helps to make a dynamic hypothesis of the situation. So stakeholders provide their expert opinion, but of course it is not a substitute for real data or real evidence. But it can be a really good starting point for further data collection about a complex problem and or quantitative modeling, for example, using system dynamics or agent-based modeling. And it is good to remember that although those diagrams can look really nice, the real product of a group model building session maybe is as much in the room as it is in the diagram, because it can help people better understand one another and better understand the problems they are facing. And it is more likely that there will be ownership for solutions that are proposed by the group in or after the group model building session. If you think group model building is interested, luckily there are quite a lot of good resources to get started with it. Here I show a book by Jacques Wennix from Nijmegen. That's a good start to really dive into the skills you need as a facilitator, and they are both technical skills and social skills. There are validated scripts available at Wikibooks. There is free software, so it is easy to draw these diagrams with vectors and arrow. And if you want to get really serious, then there is a European Master in System Dynamics, organized by Bergen University, Palermo University, and Radboud University in Nijmegen. I hope this presentation has been useful for you. The 24th of November, Esther has organized an hour for questions and comments at 3:30 Central European Time. And I'd be very happy to answer your questions then and to talk to you about this method and how it can be useful for your research. Thank you for listening, and I hope to see you soon.